Well, thank you. And thank you for inviting me to participate in this forum. As a cytologist, I look at a lot of cancer, and I'm a screener. So when the news broke on November 17th that screening and early detection would somehow not be relevant until you got to 50, it was a big concern for cytologists all over this country. I happen to have a specialist certification as a cytologist, and I'm also an internationally certified cytotechnologist, so I can work anywhere in the world. I've looked at over 1 million slides in my career, PAP test, both conventional and thin prep, the liquid base, the new stuff, and all kinds of body fluids, aspirations, breast fine needles, and the like. And I promise I won't be very detailed in the sense that this is not my cytology students that I work with. But you will see some things. I do have some pictures, some cancers. But I also want to talk about the challenges that women face in addressing diagnoses and treatment issues. Several examples I will give based on my own clinical experience and what's relevant today. We live in a wonderful country where we have the freedom to do a lot of things. In fact, I was taught that I could do whatever I wanted. I could even be a legislator. Grew up in a little country town in Dallas, North Carolina. It wasn't a booming metropolis, but I was the only girl in a family of 4 boys. My father, who I thought was a chauvinist, told me, "You can do anything you want." And my mother backed him up. You've heard about me, but I want to give some acknowledgments before I get started. To the women in government in North Carolina, Heather, Boyd, to ALEC and Dave, and to my folk at Rowan Regional. It's amazing how quickly people jump on board, and they want to help me. You're going to Washington? Well, this is what I want you to say. I had 200 slides at one point, so I had to really pare this thing down. We will not be in here that long. So let me just talk a little bit about the importance of women's health to state legislators from a cancer screener's perspective. You know, women are very important in society. If you don't believe it, ask your mother, ask your grandmother, ask your sisters. Women maintain the family, take leadership roles in the family. And to the gentleman in the room, this isn't a slight to you. But if you think about the women in your life who are very important, you'll know that they play critical roles in holding your family together. The health of the family and the communities are tied together with the health of women. It's okay when daddy gets sick, but when mama gets sick, it's crisis. In addition, women affect the whole world. It's really true. The hand that rocks the cradle controls the world. And it's also true that if we have physical, mental, or emotional, or intellectual issues going on, it hurts us, as the 2 doctors just talked about. The U.S. Department of Health and Human Services gave 5 facts that are very compelling. 14% of women 18 years and over are in fair to poor health. Not a good statistic. The 3 leading causes of death among women are heart disease, cancer, and stroke. Lung cancer, when I started as a cytologist in 1979, was something that we were told would be eradicated in the next 20 years. And it's on the rise now. And yes, that is a gross picture of a lung, and that was an autopsy specimen. So this patient did not live. This patient was a 3-pack-a-day smoker for 20 years. died at the age of 45. 18% of women 18 years and over currently smoke, and this is a risk factor for all kinds of cancers: lung, esophageal, kidney, bladder, stomach, and it's the #1 cause of stroke. 4 and 5 are just as ominous. Obesity. 25% of women 20 years and over are obese. Yes, we need to hit that gym every day. In fact, 33% of women 20 years and over have hypertension. And did you know that hypertension is not simply related to obesity? They're very tiny people that have high blood pressure, high cholesterol. So we have to start taking better care of ourselves. The top 5 health foes in North Carolina: lung disease, and that includes chronic obstructive pulmonary disease, congestive heart failure, emphysema, and cancer; heart disease and stroke; breast cancer; diabetes and obesity, as well as HIV and AIDS. Women are no longer protected. We are suffering, and we are paying a heavy price for it in our physical health. So even when I was campaigning, I couldn't leave the health alone. This young lady was the stroke coordinator at our local hospital, and she came out and she talked to people about stroke. And it was fantastic. This was a street fair. I encourage you to do some of that when you go back home. Low-hanging fruit is something that I'm going to transition into by talking about what has happened recently when we start hearing that independent task forces want to elongate the time between mammograms, and then only have it every other year up to age 75, which to me, as a cancer screener, is a ridiculous concept. We cannot go backwards and tell women that you don't have to examine your breast. You're not going to find a lump. Your breasts are too dense. There's nothing for you to find. Tell that to a cancer patient. They'll argue with you. Congresswoman Sue Myrick is a 10-year breast cancer survivor from North Carolina. The first time I met her, I had just become a county commissioner. And she's very friendly and very sociable. So she asked me, "What do you do for a living?" And I did not know that she had a history of breast cancer, diagnosed in 1999. It was chronicled on television. And she did a video diary to educate women as she went through her surgery and her subsequent treatment. And I said to her, "I screen for cancer." And when I said that, this woman, who is always so composed, just grabbed me and embraced me. And she said, "Someone like you saved my life." And I'll never forget it. Because to be validated for something that you do is not why you go into a field, but you go into it because you want it to have a positive impact on the lives of people.